Good afternoon, I'm Tony Adams.
And I'm Bill Lushbaugh.
And over the next two sessions, we're going to discuss several aspects that are really relevant to contemporary education, dealing with critical thinking and the utilization of multimedia in testing critical thinking. Really at every level of education these days, and certainly impacting higher education and the accreditation of medical and dental schools and nursing schools throughout the country, is a requirement that we teach critical thinking, the students learn critical thinking. But the issues amongst many are, what is critical thinking? How do we teach it? How do we test it? How do we test student learning outcomes? And from there, how do we know how effective we are at teaching? So what we are going to embark upon is, without putting things down, a guide to an introductory guide to what we mean by it, hopefully so that you tomorrow and by the end of the next seminar also will be able to start to implement, utilize some of these ideas in your own teaching. But it does take somewhat of a shift in the way you think to construct tests of critical thinking. And this seminar will deal more with the conceptual basis with numerous examples. And in the next one, it'll be way more practical oriented. And I say up front that as you've gathered from Ms. Totty, I'm a periodontist, a dentist, and Bill is a virologist. And so the examples that I'm going to be giving, most of them are going to be dental, but you don't have to know anything about dentistry or how to make dental interpretations. We will give them as examples, and hopefully it should be fairly obvious to you what we are trying to say. And the exam question options that we give are primarily given to second and third year dental students as opposed to senior dental students, to give you an idea of the level to which we're aiming. And we'll clarify some of those as we go. So firstly, what is critical thinking? And when I discuss that amongst colleagues, there's a huge, I think, misunderstanding what critical thinking is. It's not criticism. It's not necessarily looking at the critical point. It isn't what I thought graduate education was when we dissect and ultimately murder most journal articles we analyze for the sake of finding the fatal flaw. Critical thinking in the medical healthcare area really relates to clinical decision making. And so when we construct tests of critical thinking, primarily, but not universally, either use research or clinical scenario models. Critical thinking itself is the process of analyzing and understanding how and why conclusions are reached. So we will test for that, as we'll get into later. And some of the components of critical thinking are that it's self-directed thinking and reasoning, and this is very important when we look at testing critical thinking, that you enable the students to be self-directing and don't give prompting, particularly when they're looking at embedded multimedia. Students are required to analyze numerous facts, appraise what the connections between these facts are, again, unprompted. In the stem of the question is nothing we're doing that's telling what they're meant to look for. And then they formulate a conclusion, and from the conclusion will come across solutions. Now, critical thinking, therefore, involves interpreting and logically applying content, not the regurgitation of fact. And the word logical or evidence-based logic is very important to the concept of critical thinking. So what is critical thinking? Well, as thinking in general, it's very hard to remotely define, but it's a process and is evidence and ethically based. And evidence and ethically based critical thinking is a mandate in the healthcare profession. And it encompasses things such as deductive reasoning and rational decision making, all under the guise or the importance of logic. In the end, is reflective upon the information that the student has deduce from all the information that they are given in the question stem and in the answer options, and requires knowledge of more than one fact to logically apply and then arrive at a correct conclusion or solution. So that's certainly in healthcare, and probably in all other aspects of life, is the premise of critical thinking, is in the end arriving at a correct conclusion and solution. Now, most of us would have heard of Maslow's hierarchy, and in education there's a similar hierarchy that was developed initially by Bloom and has been subsequently modified numerous times in terms of cognitive levels of reasoning. And on the screen now is a horizontal. Bloom's taxonomy actually is vertical, but here it's moving to the right is various domains. At the so-called lowest level is knowledge, and next to that is comprehension. And most of us are familiar with this in how we test or how we learn as students, because most tests that are constructed at knowledge and comprehension recall. They're not directed at necessarily at decision making, and this is application, analysis, synthesis, and evaluation. And here in an excellently written book by Dr. Morrison from Texas University for Women, or Texas Women's University, I should say, she and her co-authors categorize these various forms of learning into these 6 categories, and all the categories to the right, from application all the way through to evaluation, are the verbs or thought processes you would utilize to construct questions that start to test critical thinking. So in the end, you are going to test, or when you teach, then test the processes of how students reach conclusions, not necessarily just test for fact assimilation. And then with multi-logic critical thinking, that is when more than one fact is given, and students must logically and systematically apply concepts to the problem to arrive at a solution. And in the end, as hopefully we'll develop over the next seminar as well, that teaching and testing is so presented that at the end of the test, that it's been a learning experience for the student. They not just get a score from it, but it's helped them put their facts and thinking together so that they become more learned, even at the end of taking an exam.
So then I'm going to speak to you just about the more classic way, the Bloom's taxonomy in a pyramid, which begins at the bottom with remembering, going up to the top of the pyramid at creating. So because the critical thinking skills require higher level multilogical thinking towards the top of the pyramid, multiple levels of applied learning and cross-discipline knowledge mastery, all of which enables them to create a single best answer by evaluating multiple sources of data and synthesizing possible explanations. So they get all this into play, but the more exercising you do of their thought process, the more they're called to be much more evaluative and synthesizing the answers that you're trying to get them to look at from accessing different types of data.
And as most of us are familiar from our own experience, most testing, certainly that I received, and when I see students studying for testing, whether they're sitting in groups or sitting at Starbucks or wherever, what they're doing is underlining, yellowing out various facts that they can learn to memorize to give back in an exam. And that so-called lower level of testing, which most students are familiar with and then sort of complain about when they first take critical thinking tests, these are called knowledge recall tests. And as an example, Again, you don't have to know anything about periodontics here. A question might be, of the following principal reason that inflamed gums are enlarged in chronic periodontitis gum disease is, and there's a list of 5 different options, and D being the correct one is edema, but I already know that students know that edema is the answer, and even though they don't know what edema is, so it's slightly critical thinking, but really it's just knowledge recall that that's what edema is, and all I'm called upon to answer is edema, and they don't have to understand the significance of it, or why it causes inflammation, or enlargement, or what you do about it, why it would matter. Well, that's all I need to know is that fact. But as we know, to our experience and chagrin often, that clinician and patient-based decision-making typically involves very complex multi-step interactions, not just memorizing certain facts about a disease or condition. That doesn't get us very far, and yet we are so often used to testing that so-called lower level. And decision-making we're confronted with on a daily basis, whether as educators or as clinicians or as architects or lawyers, involves interactions and thought processes within the discipline we are, between other disciplines, even within the same profession, in medicine and dentistry with basic sciences, which is sort of outside the profession, but it's fundamentally important to our profession, and then always with ethical and humanistic boundaries as being the principal governing factor. In fact, when we test critical thinking and put in question stems or response options, it's often enlightening to add an ethical option to an answer and see how the students react, not just a scientific response to an option. And so what we're going to deal with from now over the next seminar as well is what is multi-logic critical thinking and how do we test it. Now, multi-logic critical thinking applies to knowledge of numerous facts to logically arrive at a valid conclusion. So logic and valid conclusion in constructing tests, and always the plausibility and discrimination of answer options are at the heart of the critical thinking question. So when you're constructing questions, a lot of times we spend a tremendous amount of effort in constructing with audio and whatever a challenging question and sort of leave the options to the side as though they can take care of themselves. When students answer questions, let's say with 5 options, almost invariably they answer between 1 or 2 of the options, and the other 3 or other 2 are sparsely answered. In other words, they pick up fairly early that they were not the correct answers. There was little plausibility in those options. So when we analyze data after the exam and look at that, we then have to tweak the unanswered options, so we know that we didn't spend enough time or thought processes in them. So pay a lot of attention to the plausibility and the narrowness of your options, because that's critical thinking on our behalf too, isn't it? If we're testing critical thinking, we need to have every option involve critical thinking. So that's really very important to the test itself. So students must differentiate between plausible and ethical options. We must test them at all those levels. So what media can be embedded to STEM and responses? The question is, well, all of us are used to the written word in question options. But of course, rarely does a patient come in with written words embedded on their forehead, which you can read out and fairly quickly come up with the answer. It's not like that at all, right? So what is it that makes it more realistic? And remember that these options can be embedded also in the answer options, not just in the question stem. There's no rule that says you can't embed research data in an answer option, or a stethoscope sound, or a radiograph, or an MRI, or a video, or a lab report. So all of these data can be embedded with ExamSoft numerous times into the stem of the question and into each of the answer options if you so choose. And so rather than saying histoplasmosis, you may give a picture of what that would look like. So they have to diagnose that that's histoplasmosis or a biopsy and come to a conclusion not because you write the word down, but because they have to diagnose from the data on the screen what they've learned in class.
So when you're thinking about writing a question, one thing that a teacher should really consider is what is the concept that they're trying to test. And the alternate choices should relate to a real-life scenario that employs a constellation of possible things that are very possible and just a little bit off. So you want to construct a complex puzzle that the students need to decipher. And after they analyze all the data, they make unprompted links in logic between each piece. And then they are trying to connect the invisible dots between the pieces. And then the students will answer these questions by synthesizing an answer that takes into account all the data that they have synthesized.
Now you may say, well, this will take an hour and a half per question, etc. Well, once students become familiar with the concept of being tested for critical thinking, when we construct approximately 100 questions, and the present moment is in the mid-90s, of which about 50% are critical thinking and 50% involve knowledge recall. It takes most students finish those approximately 100 questions in less than 70 minutes, and everybody finishes them within the maximum time allowed of 110 minutes. And they have results which reflect very much typical results from testing of critical thinking versus knowledge recall, bearing in mind that when students are tested with knowledge recall, they will tend across the board in any academic discipline, knowledge recall results are between 10 and 20 percentage points higher than critical thinking questions. So you need to factor that in to when you analyze the data later. So here's an example of the dental. Hopefully you've determined the dental because these are teeth on the right. And the student's given a scenario up the top, which I again don't need to go into detail, but they're obviously teeth. In the middle are radiographs or x-rays, and in the right-hand side is what's called charting. That again, we don't need to go into what they mean, but the students ask, what would you do? Now these are second and third year dental students, and the third year in the middle of a very intense course in periodontal surgery, including regenerative surgery. And so they're asked what to do, and then particularly in the area that I'm circling with my mouse now, which is bone, this is bone, between those two teeth, and you hopefully can see that the bone is at an angle. So what would you do about it? That's the question. Now, people who are not experienced in testing critical thinking, including numerous specialist periodontists that we've surveyed informally, almost invariably get the question wrong, which is the answer being their answer typically to do regeneration, to fill in the defect, or to resect it. But when you look at the totality of the data, let's go to the left-hand side and look at the teeth and the gum margin, and you hopefully can see that the gum margin is red, just over a millimeter or so, a couple of millimeters of redness. And that is inflammation. And that inflammation is there because the gum tissue is infected by biofilm called plaque, and that plaque is there because the patient is not cleaning effectively. And that inflammation has destroyed the bone around many of the teeth, including the area in question. An absolute contraindication for periodontal surgery, including regenerative or any other disease-eliminating surgery, is the concurrent presence of inflammation. If we would do surgery in a plaque-infected site, then it would break down up to 10 times faster than if we just left it alone. So surgical options would be out. And on the right-hand side, to add further weight to that, when students would look, or dentists would look at the data, they would see that the depth of the gum, basically over the bone, is only 2 millimeters or 3 millimeters. And on ExamSoft, they can enlarge the data. They would see that it's just 2 millimeters, which is the normal depth. And surgery, therefore, would not be indicated in that area also, because you don't need to resect gum tissue to make it cleansable. It already is cleansable. The patient's just not cleaning their teeth. So in arriving at an answer as to what you would do about it, they have to make numerous decisions. Firstly, an obvious one, which tooth is number 29? How do you read radiograph and other clinical and charting data? Are there differences or significant differences between post and initial visit? And the answer is no. Are the data clinically significant? And what treatment will be most beneficial to the patient? On the right-hand side, there's no need to resect gum tissue to eliminate disease. On the left-hand side is if you try to regenerate that bony defect because of the patient's concurrent infection, they would be worse off. So the answer is E, basically keep them on maintenance. And again, almost 2/3 of students got that correct, which is approximately the percentage that universally across all aspects of higher education, that's typically the approximate percentage of correct responses you're going to get with tests of critical thinking. It can vary, of course, but it's not going to be 80 to 85%, which is going to be with purely knowledge recall, or if I gave the answer away by putting it all in the narrative form. So here's another one, which is a fairly straightforward one, which we, or maybe straightforward, in which we have a clinical scenario, asked numerous questions, and one of them is now histology. Well, I mean, if they're going to study histology as students, there's no particular point in the studying it, taking the exam, then forgetting it. We say, no, it's important throughout your dental or medical experience, so it's fair game that you would be able to relate it to a clinical scenario. So here, amongst the various clinical scenarios, one of the questions is, point of this red arrow, what is that bone like? So the student can enlarge and see that it's the bone lining the socket of the tooth. So which of those bone types most represents that? And the answer is B. And the reason, after they submit their answer at the end of the exam, the rationale comes up, so they get feedback. This is part of the test being a learning experience. They have to think about it, look, observe, relate all of the data, including the histologic data, and see B is the only one in which there are ligament fibers into the bone. These are the fibers that attach the tooth to the bone, called Sharpie's fibers. The other compact bone, A and D, don't have fibers in it, and C is spongy bone, which does not line the socket. Only compact bone lines the socket. So you have to bring together various forms of reasoning, including basic science reasoning. And then to go back to the original example that we gave, we just now have thrown in some histopathology and histology. Again, the same question, now saying which is most applicable to the case in hand. And this involves students on the left-hand side to identify that the bone is angular, as it is on the radiograph. The tissues are inflamed. This is what an inflammatory cell infiltrate in the gingival or gum tissue looks like. This is biofilm or plaque. So that fits the description. The middle one is what would happen if you did bone fill surgery, including putting in a bone graft, and the telltale sign is the epithelium, JE, against the tooth root. So they have to identify the tooth root, the significance of the epithelium, the fact that the bone is not angular and there's no inflammation. And on the other two, the CEJ is an anatomical landmark where the crown of the tooth ends, and here from the radiograph, it's too close. The bone crest is a long way from the bone, and there's no inflammation. It can't be either of those two. There's been no loss of bone around either of those two. So now I need to identify no loss of bone, no loss of bone. Bone is present, but it's there as a result of surgery, and the patient hasn't even had surgery. And here on A is a failing situation. It's anything but the other three slides. So they have to use their brains to analyze histology, histopathology, to understand regenerative surgery and how it does or doesn't work to come up with a solution. So I'll take this. So these are some of the things they have to look at. They've got to relate the inflammation, the clinical inflammation, the charting inflammation, the radiographic information to come and see what mix and matches best with the histology. And again, they have just over a minute or so to make those decisions. We deliberately put them under pressure.
All right. So then this is the change up. I recently had to take a run to the emergency room, and so I'm your patient today. And this is a video that we recorded with an opto, and this says a 70-year-old afebrile male, me, presents to the emergency room reporting pain and incontinence. The resident physician did blah, 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 and he interviewed the patient, and so you need to look at or listen to the video.
Hi, I'm Bill. I just got here to the emergency room. It's 6 o'clock in the morning. I've been having severe pain in the lower back and in the lower abdomen since 3 a.m. I'm 70 years old. I have benign prostatic hypertrophy and who knows what else. And the pain is terrible. I haven't been able to get to sleep since then. All they've done since I got here is to do a urine test. And they said they found that there was red cells in my urine. And so they decided to do some kind of x-ray. And I'm hoping that whatever the x-ray tells us will tell them what they need to do to help me. I hope that includes some painkiller. Thank you.
So we tried to determine what would be the best thing for the patient, and in fact, we know what the emergency physicians did for me at the time, and they wanted me to drink a lot of fluids. The PSA level won't really help you right now. That's for later on, but the type of pain that was involved was very strong pain and very uncomfortable, and I think you could see that in my facial expression and the way that I talked about the pain that I had experienced. And so the difference in this question is, would Tylenol be enough? Or should we give this patient narcotics? And for this type of pain, that is appropriate. And then straining the urine will tell the patient and the physician when the kidney stone has passed. And you know that it was a kidney stone because you can look in the CT scan and you can see the kidney stone up in the renal tubule just running down in the ureter towards the bladder.
So one of the beauties of multimedia as we get away from the two-dimensional imagery of biopsies and the necessary two-dimensional is that when you use sound, such as stethoscope or breathing or video, which I think this is just the beginning of a new era in testing, you're able to then test whether the student was paying attention to the patient here, or were they just taking notes to see what the diagnosis might be? Did they actually pay it? Were they with the patient? We can look at the effectiveness or critique of an endoscopy procedure or surgical technique, or almost anything that you do on a daily basis can be reduced to a video capture, and then you can test the important components of that, and do people understand that? Not just were they listening, but you may ask them, what would you do next? Or what was missing? Or what would be, from what he was saying, the drug of choice? Or what would be the side effects of the drug of choice? And even then, in the response options, don't necessarily have to be the written word. They could be what would be the side effect, and have images of a lab report or whatever you want, rather than giving the answer away just by writing things down is in the narrative form, which often gives the answer away. Imagine if we had just described these in severe pain or whatever, that automatically would have given away that we wanted to prescribe narcotics. I'm not saying it's a great question, but here we want to at least see if they're discriminating by paying attention to the patient.
So if you're going to do a multimedia question, there's some issues you need to think about, and that's the sound and video being included in an examination. The students are going to need extra time to analyze the data. They might want to listen to it a couple of times if they need be. And so the video should be brief. This one was like 45 seconds, which seemed plenty long enough. And the cell phone quality of audio, if you run a video with your cell phone, we found the audio is very indistinct. So you need to do something a bit better. And in this particular case, we used Panopto, which is an application on the laptop that has a built-in camera and microphone. So that's what you're looking to now. And we also wanted to talk about how the students experienced the critical thinking questions. And these are the second-year dental students who had just finished their final examination. They saw their grade, and then they were hit with this small quiz on how they felt about it. And actually, they seemed pretty good. If you look at the two yellow columns, they either agree with the question or strongly agree with the question. If you add those together, most of them are over 70%, which that's pretty good. So on number 4, providing correct answers after the exam in an immediate review enhanced my learning of concepts I've missed. And they said, 75%, certainly. But in number 7, taking illustrated scenario questions were less stressful than the traditional questions. No, they were apparently more stressful, but it stretches them out. It makes them think in a different way. The illustrated scenario questions require me to evaluate data from several different disciplines, and that is 88%. They said yes. And the illustrated scenario questions help me to develop a personal strategy for handling complex exam questions, and again, 65% said yes. The final question in 11, the mixture of scenario and traditional questions was or will be useful in my preparation for the national board exam.
And they were also asked to provide comments, and of course we nervously read what the comments are, but they sort of kind of interesting. The second one down, the test was horrid, which I guess that was my favorite response, I guess. None of what I gleaned in class was I able to use for testing purposes. It was by a wing and a prayer that I passed the test. Well, when we speak to students afterwards, some of them naively think that they can memorize a 1,800-page textbook, and that we're going to ask them questions that's going to be memorizing an 1,800-page textbook. And so those students needed a wing and a prayer. But the ones down after that are kind of interesting. Some of the questions I could have had more than one justifiable answer, which tells me they are in the path, they were in the right track of critical thinking, or more information was needed for some questions. I had to assume things when picking from answer choices. They simply were still on the right track. They just didn't quite dig deeply enough. So that was very gratifying, seeing some of those responses or hearing students afterwards. We felt that we're on the way to testing critical thinking.
Our research is ongoing on the critical thinking questions, and we're really looking into the best way to construct an examination. how to include multimedia in the STEM and response options, the best balance of the critical thinking versus knowledge recall questions, the attitudes and perceptions of students and faculty, performance differences in the critical thinking questions versus the knowledge recall questions. Do they do better in one or the other? And in fact, can they learn how to do critical thinking by taking examinations and drill in using these skills? And we want to follow the development of their critical thinking skills as they experience the critical thinking questions, so perhaps their achievement would increase not only over 1 year, but maybe over the 4 years of school. By the time they get to the end and they have to take their dental board exam, it's going to be really easy because they've already been through all this. And so we want to know, actually, in the end, does their performance on these different types of questions predict their clinical performance or graduation ranking?
And also, I think very importantly, the students who perform well in tests of critical thinking, that is, within a student and between students, are they ranked differently? And if that's the case, considering so much of our testing, even to get into medical dental school, is based on knowledge recall, not entirely, but a lot of it, are we in fact treating all students as though they're the same? And or should we, and I feel we have to adjust, what's the difference in mean within a student, between students, between critical thinking answers and knowledge recall answers. And it seems as though there's substantial and statistically significant differences between the both. And if that's the case, we need to be very careful in how we evaluate up to a final grade. We are going to presume we have to make some adjustments. But again, this is all work in progress.
So next time, in our next webinar, we're going to talk about how to construct the critical thinking questions using ExamSoft, and we want to talk about how to construct the effective type of critical thinking question, and how to create a case scenario puzzle using different types of data, and to incorporate the multidisciplinary multimedia, different kinds of images, different kinds of photographs of different data, and some practical tips for designing and adding multimedia to question stems. We're going to show you actually how to prepare the photographs, how to insert them into the software in ExamSoft, and a whole bunch more examples of how to design and deliver the critical thinking questions in ExamSoft.
So thank you very much for, and it's our pleasure. And if you need any help or want to contact us, email addresses are there, and we'd be happy to help you, delighted to help you in any fashion.
Wonderful. Thank you so much. We really appreciate the presentations from both Dr. Adams and Dr. Lushbaugh. We're going to go ahead and open up the forum for questions now. If you do have a question for the presenters, now would be the time to type them through the questions area of the GoToWebinar control panel. Should be on the right-hand side of your screen. If you'll type them in, I'll read them out, and we'll give both the presenters an opportunity to respond. We already have a couple waiting, so let's go ahead and get started. First question is, how many multimedia questions would you suggest each exam use?
We've been looking at that, and we started off fairly low at about 30%, and we've now hit 50%. And considering that critical thinking questions also require knowledge recall, 50% is a very conservative number. You could go higher, but there's an important role for knowledge recall questions. So we think at the present moment 50-50 is a very good balance, about 45 questions times 45. But quite a few of the critical thinking questions are case scenarios, and often the case scenario question may have a dozen questions associated with it. And by the way, if you're going to have embedded multimedia, etc., and also a case scenario, and the actual question itself at the bottom of the case, put that in bold the font for the actual question so the student doesn't necessarily have to go back and read the whole thing again. They can identify that that's the question I've seen before, because we always have the questions and the response options randomized, which ExamSoft does. So no student is taking exactly the same exam or the construction of the exam.
Great, thank you so much. Next question is, do you recommend using original Bloom or revised Bloom's taxonomy?
I would use the revised, and I strongly urge people to also read Dr. Morrison's book, and there's another author that I'm going to mispronounce his name from Arizona State. I'm sorry if I'm going to get his name wrong, and I'll give it to you next time. But their use of Bloom's taxonomy is up to date, and I strongly recommend you use that in terms of being able to contemporize your education.
Great, thank you. While we're answering questions, Dr. Adams, I've had several people ask to see the slide that has your contact information on it again. If you wouldn't mind, I guess, rewinding back to that slide so everybody can see that and jot it down while we're answering questions, that would be great. Okay, next question.
It's not the government wanting my name, right?
As long as all the correspondence is positive, right?
Oh, yeah, exactly. If not, it goes to Dr. Lushbaugh.
Next question. Next question is, how do you have students submit feedback on questions and assessments?
Well, we do that in several ways, and that's a very, very important question for a variety of reasons, because that feedback helps us teach better. And one way they do it, before I truly answer the question, is we teach testing critical thinking by the use of audience response devices or clickers in the classroom, in which on the student's laptop is the case scenario, and on the screen is the clicker question with various critical thinking options. And so they have to make decisions in the classroom as well. Now, it gives me immediate feedback as to whether they got it or not. So, but beyond that, after the exam, I always meet with them either in the clinic or informally or formally, and not so they can construct the perfect question, but what are their ideas? Because they do have very good ideas about in feedback, give feedback information. But what we is that after having get IHL permission, we IRB, I should say, permission. We give an anonymous and entirely voluntary survey to the students. We have found that when we ask them to go back onto their laptop, which they've just shut down to submit the exam, that they tend not to do it. But if we hand out a sheet of paper with a survey, it's only 14 questions on it, on the Likert scale, and so it's 100% involuntary. It's impossible for us to track. We have no idea whether you fill it out or not. You can fill nothing out whatsoever if you want, but we would love it if you do it, because it helps us, that they pretty much 100% fill it out at the end of the exam. So before they leave the room, they submit the questions, they see their score, they get feedback on their performance, and then they fill out the form all in the space of 10 minutes after they have received often quite a body blow from the exam being far more difficult than they thought. And so it tends to be these early responses are the worst, the bleakest they're going to be, and then they brighten up substantially when they find that I do then curve the results later, which I said up front I was going to do to accommodate the degree of difficulty of the exam. So it's done immediately after the exam to answer that question by filling out a survey form on a Likert scale.
Great, thank you so much. Next question is, how much time do you allot for a critical thinking question similar to the ones you presented?
Just over a minute. which seems incredibly quick, but you can't believe the number of students who finish nearly 100 questions in less than 50 minutes and do very well too, by the way. So we've found that we started off giving 60 in 2 hours, and then 70, 80, now 90, now 100. I don't know whether the sky's the limit, I guess, at some point, but we have to show some degree of mercy on us as well, because we've got to construct the questions. And so at the present moment, 90 to 95 in 110 minutes is more than enough, more than enough.
Great, thank you. Looks like we've got one more question from the audience. So this is going to be last call. If anybody has any other questions, now would be the time to get them in. Question we have is, have you used other question types to test critical thinking, such as essay questions?
Well, the answer is no. And there's not because I'm a traditionalist, but we're trying to test something that's been considered not possible to do until very recently. Even in the recent dental literature, there's been the statement that it's really not possible to test critical thinking objectively. And so we're trying to devise tests in which the computer, unemotionally, objectively, not subjectively, determines the outcome, evaluates the student. And so we've tried to take the subjectivity away from it and get to the cold, hard nitty-gritty of an unemotional evaluation of the student. So we've steered away from things that might prejudice us in our evaluation of a student. So the answer is no. We look at various forms of multiple choice questions, multiple option questions, for example, very useful ones, but no fill in the blank or essays we have tried to keep away from.
Wonderful. Thank you so much. We did have several people pose the question, wondering when your second webinar is, and we have that scheduled for November the 13th. That's a Thursday. I believe it's at the same time, 3 p.m. Eastern. If you would like to register for that webinar, you can find it at learn.examsoft.com/resources. And then it will be right there on the calendar. Or otherwise, we usually send out webinar blasts a few weeks prior to that to allow everybody to register. So you can look for that in your email as well. With that, I'd like to go ahead and thank everybody for taking time out of their very busy day to join us for today's webinar. Yes, we have recorded this webinar. Yes, we will have it up on the website for viewing in the next couple of days. All registrants will receive an email with a link to that recording as soon as it's available. And feel free to share that with any colleagues or peers that weren't able to make the live presentation. Thank you so much to our presenters, Dr. Adams and Dr. Lushbaugh, and we hope to see you all next month for the follow-up presentation.
All right, thank you.
Thanks very much.